Hello and welcome to the Cancer Conversations, a Delarc Pharmaceuticals initiative. I am Ekta Kapoor, and today, on World Cancer Day, we are going to be talking about myths that steal time, reclaiming the trust in the cancer journey. What do you think is the most dangerous part of cancer? Is it the biology or is it the belief? Because long before a scan happens, long before a biopsy, long before someone walks into an oncologist's office, something else has already begun. A story. A story shaped by something a friend said, a message that got forwarded on your WhatsApp, or a quiet voice inside that says, let's wait a little. And that story can cost precious time. And in cancer, time isn't just minutes, time is options. Welcome once again to the Cancer Conversation. As I said, I am Ekta, and this World Cancer Day, we're here to not only talk about cells or drugs, we're here to talk about the myths that delay care, break trust, and quietly change the outcomes. And more importantly, how do we take that story back? Let's talk about all of this today. With me today is Dr. Chetana Bakshi, one of the leading oncologists in Mumbai. For years, she has worked with cancer patients and not just treating the disease, but walking alongside people and their families throughout the journey, throughout their difficult moments. She is known for listening first, for sitting down, and for helping patients replace fear with clarity and uncertainty with understanding. Dr. Bakshi, thank you so much for joining us over here today in this conversation. Let's begin. So, Doctor, I want to begin with you with a moment, that particular moment which you have experienced, I'm sure, so many times, when a patient walks into you a little later than they should have. Not because they ignored their health, not because they were not sure about what they are doing, but because they were trying some alternative medicine, or maybe because they believed that something else is more convincing. What does this moment look like to you?
So for me, this is very common in our OPD, and it is very, very frustrating for us as a doctor. I'll tell you because if patient comes on time, if they come on time, stage one, stage two, when disease is very small, it is completely curable with our therapy. Sometimes they keep on waiting, they try something else, and then they come at stage three, stage four, and then we have nothing to really offer which is curative. We do offer them palliative treatment. We tell them that okay, you take this treatment, your life will become comfortable. We can prolong the survival. But wasting this kind of time changes curative cancer into a palliative disease, which is actually very frustrating for us as a doctor.
Yeah, and then to explain them also, it must be a task, right? That how do you convince them that you have come late?
No, so in our OPD, when such patient comes, there is no point in putting them in guilt that they have come late, they should have come earlier. So all those things, there is no point in discussing about whatever has happened. When patient comes, even if he has come late, he has taken any alternative therapy, we tell them okay, whatever bygones is bygones. Now let's start afresh and start what best we can do for you. So cancers are of different times. There are some cancers who know even if patient comes 1 year late, they are still in earlier stage where we can take care and we can do something. But there are some cancers which are very fast growing,
Right.
and then it's very difficult for us to treat. But yes, we do not discuss whatever has happened, and we don't want to give them guilt. What we want to do is to do best for them.
Right. So a positive outlook helps
Yes,
over here.
absolutely.
And I think that's exactly what we are talking about today. That it's not about ignorance. As you said, that you want to give them a positive outlook. So it's not actually about ignorance. It is about misplaced hope, is something what we can say. Something that they were not hopeful of earlier, but then the hope was a little here and there. And I think because most myths, they don't sound dangerous.
Right.
As far as what we've heard, right? People think ठीक है, हो जाएगा, सबको होता है या ठीक
Right.
हो सकता है. And I think that's exactly why all of this happens. So let's talk about the greatest myth of all times. I think there's so many, but considering a couple of them. So for so many people, the word cancer still feels like the end of road. People think अब हो गया कैंसर, अब कुछ नहीं हो सकता है. And that fear is actually paralyzing. It takes a toll on everything, on your mental health also. So how do you often see fear stop someone even when they want to take their first step? Because people don't want to. They know कि हो गया अब क्या?
Yeah. So commonest reason they don't come to us is that only because they feel ki, okay, now I have cancer. I don't think so I'm going to come out of it. If I go to a doctor, they will give me treatment which is very expensive and they'll take away my money and anyway my life is going to go. So that is what generally happens, right? But it's not like that. One, most of the cancers, if diagnosed early, we can cure them, we can treat them properly. Some cancers, even if they come in late stages, we can prolong the survival. And people think that treatment of cancer is very difficult and they won't be able to take it. So I always explain them, like, how are you able to take cancer, right? The effects of cancer on your body are more than the effects of the treatment. So
Okay.
might as well take the treatment because side effects of the treatment are going to be short lasting. Side effects of cancer are long lasting. So that's how we try to explain them that it is very important to take the treatment. Secondly, many people are worried about the expenses. So absolutely yes, there are many cancer treatments are expensive, but we do have big hospitals like Tata Hospital, and there are so many cancer hospitals who do give treatment in a cheaper way. And secondly, I think in our India we give money too much of importance because people are okay. I mean, they are okay कि मेरा जान जाएगी तो भी चलेगा, मेरा पैसा नहीं
पैसा
जाना
नहीं जाना
चाहिए. The reason maybe because we have less money, that's why we give it more importance. But I think ultimately your life is more important than anything, right?
Yeah.
And they should definitely, patients should come on time. That helps us, that helps patients, that helps patients' relatives.
Right. So like when you said that people come with the thought कि अब जान जाएगी.
Right.
Right? Many people come with the thought कि they were not coming to you because जान तो जानी ही है. So that is a very freezing moment for them. So how do you unfreeze them considering a patient has come to you terrified that I'm going to die? What are those first words that you would choose to tell that person?
So okay, it is very personalized, different from different people. For example, if somebody comes who's a 60-year-old lady and she has a daughter or granddaughter who's going to get married or something, so we try to tell them, "Jaan nahi jaane wali hai, you have to go and attend a wedding, or you have to go and attend a wedding of your granddaughter also." So we try to tell them like that ki it is not about jaan jaane wali hai. We will be able to prolong the life that is for 100%, and we'll make it more maybe comfortable. We'll make life more comfortable so that you can go, you can attend the weddings, you can go and attend your family functions. So that makes them feel little better, and then they are ready to take the treatment, because this is the most common thing. We get so many patients who come and tell us ki, no, I don't want to start the treatment now, next year I have some wedding in my family. I have one patient was not willing to take the treatment because he kept on saying, my daughter-in-law has got baby shower, my daughter-in-law has got baby shower. Then I explained him, baby shower daughter-in-law ka hai, aap treatment चालू करो. So we just kind of we try to tell them, okay, you will be able to do all these things, but take the treatment.
Take the treatment, right? I understand. This is actually very complicated,
Yes.
right? And especially when people come with these myths, like you just said, that I have to attend a function, I cannot take treatment. So there's another myth wherein people say कि उसको छुओ मत, don't touch it. A biopsy will spread cancer. How will you handle this
Oh,
myth?
this is the biggest myth. But today, I mean, I good you got this out. See, today I would like to tell this on camera: biopsy will never increase any cancer.
Okay.
So so people say that when you cut through the tumor increases, right?
Yeah.
But biopsy is not like that. Today, the kind of biopsy we are doing a needle biopsy. It's a core needle biopsy where we don't cut the tumor, and there is no biopsy which will increase the tumor. And biopsy is required to diagnose the cancer. Unless and until we do the biopsy, we do not have a diagnosis. And unless and until we have a diagnosis, we cannot treat the patient. So how will we know whether this is a cancer or non-cancer? So
Right.
biopsy is 100% required. And
Right.
biopsy will not increase your cancer.
Right. So it is actually the opposite of what people are thinking.
Absolutely, absolutely.
So people think that, if I disturb it, it will get worse, but it's not the case.
So doing
Disturbing
the
it.
biopsy is not disturbing the tumor. It is a small core needle which you put inside and you take it out. Okay, so it is not disturbing the tumor environment at all.
Huh.
So we do the biopsy, we take a core out, and then we see what kind of cancer, the first question, whether it's a cancer or not. And then we see what kind of cancer it is. And then we decide the treatment. So we cannot decide the treatment unless we have the biopsy.
Right. So when you're saying this, so there's so many people who are even afraid of injections.
Yes.
When you're saying you're going to put a needle in it and take it out, it is actually kind of scary.
Yes.
Right? So people must be scared of the procedure in itself. How do you handle the fear?
So okay, so that is one just has to talk to the patient. So that is some there is something we call it as a verbal anesthesia. So we keep on talking to the patient about so many other things other than the biopsy, and then biopsy is done under local anesthesia most of the time, so that it's not painful at all. But it is the fear, right? So before we give the local anesthesia, we keep on talking to the patient about so many other things other than the cancer, like आपके कितने बच्चे हैं, where do you stay, what do you do, and how's your life, all this. So patient gets distracted, then person gives local anesthesia, and then we do the biopsy. This is what commonly we are doing in our
So this
hospitals.
is more like how
And
you
they,
would treat
yes,
kids,
right,
right?
yeah,
Like,
absolutely, absolutely. So they are kids only for us. Our all
yeah,
patients are
I'm.
kids. So that's how we do.
This is very interesting. So many of us still carry an old image of chemotherapy. In fact, I just met someone who was saying that is radiation the only thing that can be done? So it is endless sickness and
Yes,
people going down on their immunity. Maybe
yes,
people feel that there's going to be an unbearable suffering
right.
which will last forever. But today's treatment, it looks different. What we are talking about is a little older than what we have
Right,
today.
right.
How is it different? How is the modern cancer treatment different from what it was?
So, cancer treatment includes not only chemotherapy, it includes surgery, it includes radiation, and systemic therapy. Now, chemotherapy is a part of systemic therapy. There are other systemic therapies, like sometimes we give immunotherapy, sometimes we give targeted therapy. So, there are multiple kinds of systemic treatments available. So, people are more scared of chemotherapy because they always think about side effects of the chemotherapy.
Right.
However, nowadays with the newer drugs, we don't see so much of side effects. Secondly, supportive care has changed so much in last so many years. Like a simple thing of like hair loss, we see most of the cancer drugs will give rise to hair loss, right? So newer cancer drugs do not give rise to hair loss. And nowadays we have this scalp cooling machine, which we can that cooling cap which we can keep on the head, which will reduce the hair loss. Then secondly, second common is vomiting. People are scared about vomiting, but newer anti-emetic drugs which we use, they are so good. So nowadays we hardly see anybody who comes with vomiting, who comes with too much of hair loss, too much of weakness. So it is very well tolerated treatment. Having said that, absolutely every drug will come with some kind of side effects. I'm not saying that there are no side effects at all. However, they are much tolerable. We have good treatments for that. And if you know, if as you initially you said, if there's a positive attitude, if you look at it positively, then it is much bearable. And secondly, most of the side effects, they are temporary. There are hardly any side effects which are permanent side effects of chemotherapy. So when there are temporary, so for examples, if somebody's chemotherapy is for 6 months, in 8 to 9 months, patient become normal. So this is how I tell patients also that if you have a cancer and you are not taking the treatment, you will have this suffering lifelong. If you are taking chemotherapy, suffering will be only for 5 6 months. So
Right.
this is how also we explain the patients.
Right. So when someone, considering someone comes to you, they want to go through the treatment, they want to get cured, but they are scared. Considering one of your female patient walks in up to you and says, "I am ready to go through the treatment, but I love my hair." How would you, any moment when such kind of a thing happened?
Yes. So again, this is very common. So as I said, we sometimes we do tell them about the scalp cooling therapy, which obviously does not give any 100% benefit. 50% of the people still lose their hair. Secondly, we there are certain other things, like there are different kinds of wigs available. So I tell them ki you use different wig because you have a straight hair. Use curly hair wig. Use Madhuri Dixit wala wig. You can use some film star wala wig, which you will feel like you are a film
More
star.
beautiful, yeah.
So all those things we try to tell them ki use this, use that. Nowadays, so many colored this ribbons are available. They can put that on here there, so they can convert their baldness into some kind of fashion.
Right.
So
They
that's
can
how we
get
keep on
creative.
explain them. And sometimes they do listen, sometimes they cry, but ultimately, everybody accepts. When they understand that chemotherapy is helping them, then they accept.
So being a doctor, being a counselor, and being a beauty advisor, everything at the
Yeah,
same
actually
time,
true.
right? Let's pause for a moment and let's get practical because fear grows in silence. So if you or someone you love is facing cancer, these are the questions I would want you to feel confident in asking your doctor. Ask your doctor, can you explain my diagnosis in simple words? What is the goal for this treatment and for me? What side effects might happen and how will we manage them together? And what happens if we wait? what kind of support can safely go alongside the treatment? Which will be the most conversative one?
So every question is equally important and every question needs to be asked. However, the first question, opening question, has to be opening question always has to be, is it really a cancer or not? And this is what we generally hear from the patients. So they, सच्ची में कैंसर हुआ है? Are you sure? They'll ask us, are you sure? So this is the first question which opens the conversation mostly.
And the question gave me goosebumps.
Yeah. So one by one, and so the first question generally we get is, and one everybody should ask is it really a cancer? Then the second question should be what kind of cancer it is. There are different kinds of cancer. And then third, which is very important, is what stage it is. Because whole prognosis, whether patient is going to become all right or not, will depend upon the stage of the cancer. So what is the stage of the cancer? Then the fourth question they should go and ask doctor is, what are the different kinds of biomarkers? What are the different tests you have done on my cancer tumor? Because nowadays, it is not only chemotherapy, right? We give targeted treatment, we give immunotherapy. So we are doing tests for these targets, immunotherapy for almost all the cancers. So patients should know or relatives should know, okay, have you done all these tests? So what do you think is the best treatment for the cancer, for this cancer which I have? And if this is the best treatment, is it state of art treatment here? Can we get some different treatment somewhere? And then what are the side effects? And then is it curative or is it palliative? And then comes key, what is the expense? So there are 7-8 questions which everybody, all patients should ask the doctor. Starting from, is it really a cancer? What is the stage of the cancer? Whether it is curative or palliative, what are the different kinds of treatment available? And then again, alternative medicine. This question everybody asks, and you should definitely ask. Can I take some alternative medicine? Can I wait? How long can I wait? All these questions. So it is very important to open up to your doctor. If you ask, no doctor is going to tell you, don't ask me this question.
Yeah.
If you ask, and no question is a stupid question. Ask more questions, you get more answers.
So curiosity is more of an interesting point for you because it helps the patient.
Yes, it helps the patient.
So when we're talking about these alternate medicines, so there are so many people who think that alternate medicine can actually cure cancer. And I think this comes as a very human question. It's very human to ask these questions. That, they hope for something that's more gentle because they're already scared of the kind of treatments that exist today. So they wish for an easier path. Everybody wants to choose something, it's easy. So how would you honor that hope without letting the precious time pass by?
So I always tell them, and which I'm telling you also, that it's not that alternative medicines are not good. I'm not saying that they are not good, they will not cure you, and my medicines are good. Because many times even I'm not giving them cure, right? Many times I also only give them palliation. However, problem with the alternative medicines is they do not have data. Okay, when somebody is taking some alternative medicine, like for example, I am practicing allopathy. So we have a data, we have some results, research to show them that if I treat 100 patients, maybe 80 patients may become all right, 20 patients may come with the relapse. So I have this data, and backed on that data, I treat the patients, right? Problem with the alternative medicine is because there is no data, we do not know. Nobody knows. Whoever is giving them treatment, they also do not know. So without complete knowledge, without data, it is very difficult to treat the patients. And in my view, one should not be doing that without the evidence. So some of the alternative medicines may be good also. I'm not saying they're all bad, but there has to be a proper research which needs to be done by proper doctors, maybe Ayurvedic doctors or whoever. They should do a proper research. They should come out with the treatment. Okay, this is the treatment which helps. Then for us also, it becomes easier to tell them, okay, if you don't want to take this, you take that. Life is precious. You can't take it lightly. Ye leke dekho. It is not like that. Ye leke dekho, right? It has to be a proper data-backed treatment.
Right, and this is something that people fail to understand. They
Yes.
would just go with belief and not with research.
Yeah, the problem is, nowadays with so much of WhatsApp University and YouTube, everybody just goes and people travel in local. So today only I met one of my patient who was saying कि हम biopsy नहीं करना चाहते, and so I asked why you don't want to do the biopsy. Then even I met someone in local whose wife, she went through the biopsy, then she started the chemotherapy. After 2 months that patient died. Then I asked, do you know what kind of diagnosis she had? The patient did not know anything about the diagnosis of that patient, what kind of cancer she had, but they just knew that biopsy was done after 2 months. But we don't know that she must be having stage 4 disease. She must be having a bad biology disease, right? So people just, listen something and then they follow it. So that should not. So this blind belief, because they don't want to do something and they want somebody to push them. Okay, don't do this. So this should not happen.
Right, they don't want to go ahead and take their decisions, and
Absolutely.
because they don't want to blame it on someone.
Yes. That is a human tendency to blame it on someone.
Yeah, yeah. So, so we are surrounded with articles, with videos, and it does feel overwhelming.
Yeah.
You're walking down the street, you see a poster on a rickshaw that says "Cancer झाला है, come to us."
Right.
How would you tackle this? Like, and how would I know whom to trust?
Yeah, so I always tell them one thing, that it's okay to Google, it's okay to go through AI and all, but whatever you read, no, please come back and ask me. This is what we have read. Is this okay or not? Or it's okay to take second opinion, third opinion from a proper doctor. For example, if there are 4 5 medical oncologists, you go to all 4 of them and take their opinion. There's nothing wrong, but don't go to rickshawala, right? You go
Yeah.
to a proper doctor, and I'm sure you won't get very different opinions also, because we have some standard of cares. So 19-based difference is always there, because like in my experience, if I feel this drug works well in somebody's experience, the other drug, so both drugs are same only. It is just no little bit of difference. So one should take second opinion. Nothing wrong in that, but they should go to a proper doctor to take a second opinion rather than taking an opinion from a conductor or some local person or somebody like that.
Right. Because aju baju wale, the neighbors will always recommend you go here, go there.
Absolutely.
So they should take it from a
Yeah.
medical practitioner.
Absolutely.
Right. So, ma'am, other than these questions that I have, there are so many, as a layman, I would say, as one of our viewers, when I have heard about cancer, like today I met somebody who lost his father in the year 2015 to cancer. Back then, we did not have so many treatments.
Right.
Today, I think we are progressing.
Yes.
So, how fast do you think we're progressing, and what is the pace of it, and how fast do you think we'll be able to reach the next stage?
So in oncology, we are progressing very, very fast. So 2015 is just 10 years back, right? And in last 10 years, we have really made a very good progress. Since the time this immunotherapy have come, and now new cancer vaccines are coming. So everybody of us are looking for, someday, maybe in next few years, we may find some cure for the cancer. That is what we are looking at. We are really progressing fast. So a time may come when we may not be using chemotherapy, because everybody is scared of chemotherapy.
Yes.
So we may not be using any chemotherapy. We'll just give immunotherapy or targeted therapy to the patients. So we are trying to find newer biomarkers for that. So I'm sure in next 10 15 years, we'll be much, much ahead of what we are now.
Right. And ma'am, before we reach that level, there is this one stage wherein people don't realize that they have cancer. And there's so many times that people, I'm sure patients come to you when they've reached their stage 3
Right.
and stage 4 maybe. How is it that they can realize? Are there some tests, like for diabetes patients, people should regularly do a blood checkup? So what should people do for a cancer
So
checkup?
for cancer screening, basically there are only 2 3 cancers where screening tests are available, and they are helpful. Like for example, for breast cancer, we have this mammography, which ideally every woman should do after the age of 50 once in a year, and after the age of 40 once in 2 years. And then we have for cervical cancer, we have pap smear, which we advise to do once in a year for everyone, all ladies. Then for prostate cancer, we advise to do serum PSA levels. In colon cancer, colon is intestinal cancer, if you have family history, if you have a strong family history of colon cancer, then we do advise them to go ahead with the colonoscopy once in 2 3 years, or just a simple test like stool occult blood test for cancer screening. But otherwise, overall, for screening of cancer, there are no tests available. At the same time, patients will come with the symptom. So we always advise that don't ignore your symptoms. If you have lump anywhere in your body, if you see lump here or there, or if you have a hoarseness of voice which stays beyond 15 20 days, if you have blood in your sputum, or if you are bleeding from any orifice, from ear, nose, oral cavity, or per vaginum, per rectum, if you are bleeding, then you should immediately go to the doctor. So these are or if there is unexplained weight loss, if you are losing, so sometimes people try to lose weight, which is very common. But if you are losing weight unnecessarily, and if you see that you have lost almost 5% of your body weight in a short span of time, so all these things, they can be symptoms. I'm not saying they are always they are cancer, but they can be symptoms of cancer. In such time, you should definitely go to doctor and get yourself checked. And again, people are afraid of oncologists. They don't want to go to a cancer doctor,
Yeah.
which is understandable. You don't have to go to a cancer doctor. Go to your normal doctor, go to a normal general practitioner, get yourself checked. And I'm sure if there is something like that, they will refer you to a higher center.
Yeah.
So this is what should be done.
Yeah, so rather than getting scared, today being World Cancer Day, I think doctor herself is saying that don't be so scared of cancer. It's okay. It could be a lump, but you still can always get it checked, right?
Right.
It's there's no harm in it.
Yes, yes.
Right. Thank you so much, doctor. Don't just be aware, rather be empowered. Just like we spoke, that if you get yourself checked, and that in itself will make you empowered. You want to go through a treatment, that is making you empowered. You are actually going and telling your friends, your family members, go and get a treatment done. That is empowered enough, right? So it's a timely conversation. Talk, ask, and please don't stay silent, because a myth loses its power the moment it is spoken out loud to the right person. And I think this is where the problem is. Rather than speaking to the wrong person, they
Yes.
should come and speak to the right person. Any final message that you would like to give out to our
So,
viewers
as you
today?
rightly said, don't hide. Go to doctor immediately. One. Secondly, this time, 2026, our Cancer Day ka theme is United by Unique. So it is, person before the cancer. So it is personalized medicine is what the theme is. So we don't see patient as a machine, or not all patients are same. So it is every person comes before the patient. So it is personalized is what the theme is. So you go to a doctor, talk to him as a person. He will see you as a person, and then he'll treat you.
Yeah, not as a patient. So
Right.
you are not an object or not.
And it's a personalized treatment means if there are 4 patients of the same disease, so not one size fits all. So maybe treatment may be different for everyone. The way doctor talks to everyone will be different.
Right. And we've been talking about this right over here at the cancer conversation also, that we have personalized treatments.
Yes.
And even our doctors, they have always made us feel, in fact made all of you feel, that they are here for you. So don't miss out on this opportunity. It's very rare when you actually meet someone like this who is saying that आपको एक पॉजिटिव आउटलुक रखना है, आपको हर चीज़ को ऐसे देखना है कि ये कर सकते हैं हम, वी कैन sustain it
Absolutely.
together. That's one thing that I have always noticed with you, doctor, that you've never said कि I don't think you would even say this to your patient, right, कि आप ठीक हो जाओगे. I think you're always said we will go through it together and we will overcome
But yeah, but that is the fact, cancer journey is such where everybody has to go together.
Yeah.
Patients, relatives, and doctors. Everybody go together through it. And then only we can win. One person cannot win this. It's a difficult fight. So all 3 of us should be together.
it. Right. Thank you so much. Thank you so much for giving your time, doctor. It was lovely talking to you. As always, there's always so much of information that comes from you. And it's a privilege to have you over here at the Cancer Conversation. Thank you so much.
Thank you so much, Ekta. Thank you so much.
This has been the Cancer Conversation, a Delarc Pharmaceutical initiative created to turn insight into action and fear into clarities. If today's conversation helped even one person, book a test, ask a question, and reach out sooner, then this is truly mattered. Please share this with someone you truly care about, because the right words at the right time don't just change stories, but they also save lives. For trusted evidence based cancer information, visit worldcancerday.org. I am Ekta, and thank you so much for listening. Thank you for being here with us, and thank you so much for choosing the courage over silence.